Good morning. My name is Cesena Medina. Today, I'll be doing my persuasive speech. The title being Euthanasia is a morally acceptable option for terminally ill patients. Here's my ID to confirm my identity. So, let's get to it. Imagine enduring excruciating pain every single day, knowing there's no cure or relief. Shouldn't you have the choice to end your suffering if you wanted to? I researched this topic extensively and witnessed firsthand the suffering of someone terminally ill. I also read a bunch of theses and dissertations about this topic because I was very passionate about it. So, this issue affects not only patients but also their families, healthcare professionals, and society as a whole. So, euthanasia should be legalized for terminally ill patients because it reduces painful suicides and ensures ethical oversights by health by healthcare professionals being there and respect patients' autonomy. This is what I want to do: is respect patients' autonomy. So, euthanasia is when a terminally ill patient decides to end their life or their suffering with medical assistance. Legalizing it requires safeguards to ensure it's voluntarily, is ethical, and respects the patient's autonomy. So, proper medical oversight reduces the risk of botched euthanasias. As Dr. Melanie Aradika states, healthcare professionals can prevent misuse and ensure safeguards are followed. So, care based approach to legalization. Rather than seeing euthanasia purely through a legal lens, it should be viewed as part of a patient centered care. Research by Laura Fine, she went her dissertation, it was in University of Birmingham, highlights that incorporating providers can ensure euthanasia is ethical and respects the patient's wishes, relieving and suffering and respecting autonomy. Terminally ill patients should have the autonomy to choose how they die. My experience watching my father die or suffer from lung cancer and reinforced my belief that euthanasia should be available to health and suffering with dignity. My father went in less than 2 months being able to walk and socialize with our family to being completely bedridden and have to have assistance for everything. That broke him both physically and mentally. He suffered with this illness until his last breath, and it was so bad seeing my father pass away in such a way. Um, it was not just physically deteriorating, it was mentally deteriorating for everybody involved, but specifically for my father. And this reinforced my belief that euthanasia should be an option. I'm not saying that everybody has to go there and get euthanasia if they wanted to and they're tired of life. No, it's more of a having the option if the suffering gets too great. I think everybody should have the option for that. So, what are some reservations that people have about euthanasia? Isn't there a slippery slope? Well, evidence from the Netherlands show that strict guidance prevents misuse. So far in the countries that it's been implemented, euthanasia, it has worked out really good. Does euthanasia conflict with the sanctity of life? We have to view it as an end of life care. End of life care can balance autonomy with respect for life, emphasizing the reduction of suffering. Patients have the autonomy to choose whether they want to live or die. That's what I'm saying. If they're viewed with an illness that legitimately it cannot be cured. So, couldn't palliative care be enough? Palliative care helps many, but it doesn't address all forms of suffering, particularly existential pain. Euthanasia provides an option when palliative care isn't enough. Euthanasia is basically the last option when you went through all extensive through all the other options available out there, but it should be an option at least for everybody. It should be a right to have. So, in conclusion, euthanasia should be legalized to respect autonomy, relieve suffering, and ensuring safety through medical oversight. In the face of unbearable pain, the right to choose a dignified end should be a fundamental human right. Legalizing euthanasia should allow us to prioritize compassion and humanity in life's final moments. Thank you so much, and this was Desiree Medina.